Our next speaker is Gideon from the University of Wollongong, and he's an epidemiologist working in chronic diseases with a particular focus on the social determinants that control our health. He's a regular contributor with the Guardian newspaper and writes for a range of other publications, and it's with great pleasure that I welcome Gideon to speak today on predicting COVID-19. What did the models tell us?
Hi, I'm Gideon Meyerowitz-Katz. As Professor Cripps said, I'm an epidemiologist with Western Sydney Diabetes, primarily a chronic disease epidemiologist. I'm also a PhD student at the University of Wollongong. I write for The Guardian, and you may have seen my blogs or on Twitter online. And today I'm going to be talking about a little bit about COVID modeling and uncertainty. And in particular, I think I'm going to try and highlight why the models were mostly wrong, but what that kind of means for modeling, and also, I guess, for us as a society, and why we produce models of pandemic disease, and how that's been a bit misunderstood, or I guess at least misapplied, particularly in the media, when people discuss models and talk about the terrible fates that were going to befall us, particularly early on in the pandemic. So I think the first point that I really wanted to touch on is the use of models, because everyone has focused very much on the models that predict the future. And those are obviously, I guess, in some ways, the most visible modeling models that have been occurring during this pandemic. But I think it's important to recognize that they are not the only, or potentially not the most important models that have been done. So, for example, a lot of modeling has been conducted to estimate key disease parameters. So the basic reproductive rate, the R0 of the disease, which is the average number of people who are infected for each person who is infected with the disease, so how many people you pass the disease on to, is essentially based on a model. And there are a number of ways of doing that, which have been applied in different ways during the pandemic. Interpreting surveillance data, so looking at how many cases you see in a country versus how many cases you might expect to see, for example. Shortcomings of surveillance systems, so something that I'll touch on a little bit later, but that is increasingly becoming important, is looking at how many people have died and how many people we would expect to have died given the excess mortality, and how that relates to a country's surveillance system, particularly in places that have been hard hit. Tracking disease spread. So this is something that I think the Office for National Statistics in England is doing quite a bit. And I think it's really under-recognized how important that is there, because it is quite challenging to know the number of cases in a country based on testing. Therefore, the Office for National Statistics is using a fairly interesting model to estimate the number of people who are infected with COVID-19 on each day. And while that's, again, it's not headline news to say that X many people are infected today, it's very important for policy and for decision makers. And then lastly, the thing that we're all focused on, and the thing that's been in the news constantly since early February, even late January, is the predicting scenarios into the future. But I think really the key point here is not only that it's not just prediction, but also that some of the predictive models that we really have been focusing on are based on themselves other models which are also uncertain. So you get the situation where you have a model that's predicting X number of cases or deaths in the future that is based on another model which incorporates a range of uncertainties. And that model, some of those uncertainties are uncertain because they themselves are modeled scenarios. And so the eventual outcome of saying, this is what will happen, or this is what we suspect may happen, is more complex than just the final figure that you see in the news. So I thought I'd briefly look at one of the more interesting uses of models, I think, which is looking at the basic reproductive rate, or the effective reproductive rate of the disease. So, and to illustrate how broad this uncertainty can be. So we're all quite used to the number, I think, that's quite commonly put out in the news these days, which is an R0 of somewhere between 2.5 and 3, or 2.2 and 3, or something like that. And that's been used quite a bit. That was initially based on work done in China and then expanded on as the disease spread. But a more recent paper by the CDC, and this was published, I think, in the CDC's Infectious Diseases Journal, looked at what happened with the transmission of the disease in a totally disease-naive population. So what happened when COVID-19 was spreading in late December, early January, before people had even recognized that there was a disease there. And we know that that was happening, broadly speaking. And this disease modeling that they did suggested that in a completely naive population, the R0 may have been 5.7, or even, and with a confidence interval ranging from 3.8 to 8.9. And that is very substantially higher than what we're seeing today, or what we are expecting to see today. And that doesn't necessarily mean that either of those numbers are true, or that the disease is more infectious than we initially thought. But it does show you that the modeling here is not as, it's not a number that you can necessarily point to and say that is truth. It's really saying this is a broad range of uncertainty, and it is potentially possible that a lot of different things are true in this situation. And I think what really kind of illustrates this as well, or what this illustrates rather, is also the importance of assumptions. And I mean, this is stuff, what I'm saying now, I hope I haven't, I'm not boring all of you, because this is the sort of thing that people who work in statistics and people who work in infectious disease, or epidemiologists broadly, you know, we're aware of, because it's the sort of thing that is drilled into you when you do a statistics course. But I think it's often the importance of assumptions and the uncertainty around modeling isn't really represented when those models are talked about, or when they're presented, particularly in the news, as I say. So, you know, every model is based on its assumptions. For these ones, two important assumptions here for the modeling the CDC did of the basic reproductive rate are the incubation period and the serial interval, which is how long disease takes to manifest symptoms, and how long it takes for the one person who's infected to pass the disease on to another person. And I'm not saying that either of those numbers are incorrect, but it illustrates how challenging it can be to produce a model that is informative, because the assumptions are everything. And if you change those numbers a small bit, suddenly your reproductive rate might be completely different to the number that you've told everyone. And I think it kind of speaks to what Professor Gelman was saying this morning, which is that people are loath to walk back their predictions, I think because everyone focuses so much on that headline figure. But the reality is that your assumptions may be and often are flawed, particularly with a new disease for which evidence is constantly emerging. So you can't really, it should be less of an issue to say, oh, I was wrong. You know, I mean, obviously in society, it's quite challenging to say I was wrong, but it should be less of a problem than it is. So talking about the purpose of prediction models, and I think this leads on quite nicely. Everyone wants to focus on the number, the specific figure, you know, 10,000 people are going to die, 50,000 people are going to die, etc. But I think that's a broad misunderstanding of the point of modeling. Prediction models don't really give us truth. They don't speak to the truth of a situation or not. And I think this is really well illustrated by Dr. Alan Cheng, who's an infectious disease physician and epidemiologist from Melbourne. He said this on Twitter, and it was part of a very informative long thread. I highly recommend reading it all. But basically, prediction models give us what if, where we can look at a range of different scenarios that are interesting or potentially informative. They don't tell us what will be, because there even small changes in your assumptions and your parameters can massively change the model, and there's no possible way to capture the spread of human complexity in a mathematical model. Even the most complex infectious diseases models only kind of scratch the surface of human society's complexity, of this incredibly complex system that we all live in. And I think a really good illustration of this is financial markets. So actuaries, broadly speaking, look at predicting risk and the likelihood that one thing or another will happen. And we all, intuitively, we all understand that no one can predict what's going to happen in the markets, because if someone could predict what was going to happen in the markets, they would be an overnight trillionaire. You know, they'd suddenly own all of the world. But it's harder to apply that to infectious diseases modeling, because all of these numbers are given as truth rather than as the sort of uncertainty that we understand more intuitively for financial stuff. So what that kind of leads on to what was the point of models, what is the point of models, and what can we learn from all of them. And I think a great way of illustrating this is by looking at some of the less good models and some of the more good models. So these are two that I picked out. I was looking at some of the predictions people had made in February, and it was a bit astonishing. But what we've got here on the left is a prediction made by I think called Thomas Puyo on Medium, and another one on the right made by James Ross, who is a computer scientist, I believe. And I don't want to, with all of the models that I'm talking about, I don't want to say that they were wrong. Sorry, I don't want to say that they're bad because they were wrong, or good because they were right, because I think that's the wrong way of looking at it. The point is, did they give us useful information? So, for example, on the right hand, we've got someone saying that 53 million people will die by mid-April, in February, or maybe early May. And that's not a particularly useful thing to model, really, to say, what's the absolute worst case? How many people are going to die? Everyone should be, you know, selling their assets and jumping ship. Let's all go to Mars. Whereas some of the better models, and I think these are some really good examples, gave really specific and actionable insights. And while they were also wrong, so here we've got on the left, sorry, it's a little bit occluded there. There was a modeling process looking at the number of people who were infected in Wuhan during the early outbreak stages, and kind of suggested that there were a large proportion of people who were unrecognized cases, and that would be an issue in the future, which it was. And then one of the most impressive models, I have to say, which was based off Diamond Princess data and looked at how severe we could expect the COVID-19 to be in a range of populations. And that was by Verity et al. in March and late February. So these were wrong. They were some of the, you know, these are leading academics publishing incredibly complex and fabulous papers that were wrong, but they were really useful. So some case studies here, quite briefly. I think it speaks to the statement, all models are wrong, but some models are useful, which is something of a statistical adage. So here we've got a paper that was published really quite early on in the pandemic, in early February. I'm not sure if you can see that easily, that looked at whether we could expect to be able to control COVID-19 using our traditional measures of control, which is contact tracing and testing and contact tracing and case isolation. And basically what they showed was that over a range of scenarios in almost every possible case, contact tracing and case isolation was not sufficient to control the disease. And while the figures that you can see here on the right, those graphs, they are wrong. Broadly speaking, that's not what happened. But every one of those graphs points to an incredibly useful finding, which is that we had to change the way our methods of disease control to contain the pandemic. And while, you know, the exact numbers weren't correct, what they proposed informed policy in a very useful way. And I think another example of this, while it is much maligned these days, was the Imperial College modeling produced in March of this year. So this is a graph from the Imperial College modeling on COVID-19 from the Imperial College COVID-19 response team. And again, you know, the top line figures here were incorrect and are incorrect. And you'll see in the next slide that the numbers are off 100%. But what they did show is that different policy responses would have different impacts. Some of these would be more likely to have a greater impact, and some would be more likely to have a lesser impact. And it's not to say that their numbers were correct. It's to say that what they proposed was, broadly speaking, very useful for people who were looking at implementing policy at the time. And I think this chart also speaks to that, because everyone looked at the top line figure, which you can see at the bottom left, which is that the absolute worst case scenario was 550,000 people dead in the UK based on their model. And I personally, in general, that's a really bad way to look at this, because the scariest scenario was always a very unlikely event. No one ever really thought that COVID-19 would run completely rampant in society and no one would take any effort to prevent it. But what they did show was that the different interventions and at different times would have vastly different impacts on the expected disease spread. And I think, broadly speaking, that prediction has come true. And that doesn't necessarily make the model, you know, right or wrong, even though some of their numbers, if you look on the in these tables, some of their numbers are quite close to what actually did happen. The point here is that the model was useful, even if the specific numbers were off. And it was also uncertain. Like, everyone saw the one curve in news headlines, and that was, I think, what a lot of people took away from that model. But if you look at the tables, they present so many different scenarios, and it's really understanding the uncertainty there that's the biggest take home, and not so much the specific numbers. In the last couple of minutes, I just got a couple of examples of models that are looking to the future, that inform what we're thinking about now. This, I think, was a really good paper that looked at whether herd immunity might be acceptable in Japan. And here, again, I think the take home was not specific numbers. And I know I'm banging on about it, but I feel like it's really, really important. They showed that, barring the disease, COVID-19, being substantially less fatal than we know it is, or than it's likely to be, and barring the spread being much less broad than we think it will be, it's unlikely that herd immunity would be acceptable in Japan in the future. And that's really interesting, because even if you say that, you know, they got the R0 wrong, or they missed the number of people who we would expect to be infected, you can say that the take home here from the model is broadly true, or very informative, that herd immunity strategy in Japan is unlikely to be very publicly feasible. And another way that I think, another place that I think modeling is really showing benefit is in, as I said earlier, kind of that informing surveillance and informing our knowledge of the disease. Even now, you know, 6 months into the course of this pandemic, there are still so many unknowns. And this is an example from the Financial Times, where they're looking at excess deaths, excess fatalities as a measure of the severity of COVID-19. And this can also be used to say, well, which countries are recording deaths correctly, which countries aren't recording deaths correctly, and what can we do to fix those problems in real time. So I think I'm about at the end of my time, and I'll happily take questions afterwards.